Hello. Yeah, hi. Can you guys hear me?
Yes.
Okay, great. Yeah, I was having some problems, but we can get started now. Let me share my screen. Okay. Can someone confirm if they can see the screen as well?
Yes,
Yes,
sir.
sir. Okay. Let me confirm if I'm recording. Yeah. Okay. So, good afternoon, everyone. Welcome back to week 5 of previous year's discussion on drug delivery principles and engineering course assignments. Uh, Yeah, so let's get straight into it. So basically, we'll go through all the questions that have been asked in the previous year assignment, and we'll see if we can solve them and if we can think of ways to solve them. So the first question reads: Why do proteins absorb on material surfaces? Pick one option. Because they are weak surfactants, because they tend to increase their activity after interaction with biomaterial surface, to prevent biofouling of the surface, because they are strong surfactants, the proteins will never adsorb on material surfaces or to decorate the surface. So, why do proteins adsorb on material surfaces? Let's go through the options. We'll start from the bottom. To decorate the surface, proteins adsorb on material surface to decorate the surface. Need not necessarily be. Doesn't make sense, right? Proteins do not have conscience, so like they don't want to decorate anything. So, does not make much of a sense. So is it because proteins will never adsorb on material surfaces? That's not true. So it's quite opposite to what the question is asking us to answer. Not true, because they are strong surfactants. Okay, are proteins strong surfactants? What are surfactants? Do people know what a surfactant is? Okay, so let's come back to this. If you look at the other option, so to prevent biofouling of the surface, what is biofouling? So, what do we mean when we say biofouling of a surface? So, let's say you have an implant that you've placed in the body of a patient. Something happens, and we call it biofouling of the surface. If you do not treat the implant or do not pay attention to what kind of materials you're using. So, what is biofouling? Any idea?
No, sir.
Okay, so basically, what happens when you place So okay, so let's take a case scenario. So let's say a person comes to the clinic with a bone fracture, and you want to sort of mend his bones together, and you want to put these implants to hold the two broken pieces of bone together in close proximity, so that there's a lot of osteoengineering that happens and the bone regrows and rebinds, right? So but you don't know, so this is the first time you're doing it, so you do not know what kind of materials to use, what kind of reaction the body might have, so you'll just use some metal materials to push and bind the bones together. But what happens is, if you do not properly treat the surface of this implant, and if you do not properly choose the materials that you're putting in the body, a lot of basically proteins, cells, and so on and so forth will start getting deposited on the surface of your implant, as a result of which it's a lot of substrate for a lot of bacteria as well. So bacteria like pseudomonas aeruginosa, all these obligate pathogens, they'll start growing on the surface as well. So this, the implant surface that you have kept in the body, like you can see layers of proteins and bacteria adsorbed on them, and it's basically, uh, depending on the material, it can either rust or it can break apart and get dislodged in the body. It can cause severe inflammation and immune system reactions because there's a lot of bacteria growing and so on and so forth. So that's biofouling of the surface. So essentially what the question is asking is, why do proteins adsorb on the material surface? Is it to prevent biofouling? Not true, because biofouling is, as a process also happens because proteins begin to adsorb on the material surface. So not the correct option. And the other option reads, because they tend to increase their activity after interaction with biomaterial surface. Is that true? Do proteins tend to increase their activity after interaction with biomaterial surface? Not necessarily true for all protein. Like, really depends on what kind of protein it is and why it's increasing its activity, and it's very rare to come across such proteins. So not entirely true, right? uh, so the other option reads, because they're weak surfactants. So we have a couple of options here. Either they're adsorbing on material surfaces because they're strong surfactants, or they're adsorbing on material surface because they're weak surfactants. So what is a surfactant? So a surfactant is essentially a molecule that has a hydrophobic group and a hydrophilic group, right? So it can form missile structures, and it can interact a lot with oils, but at the same time it also has a polar head region where it can interact with water as well. So essentially that's what a surfactant is. Now, are proteins strong surfactants or weak surfactants? Any idea? So proteins are weak surfactants. They're not strong surfactants. If they're strong surfactants, what would happen is, uh, essentially you will not have, you will not get to have this organized structure of a cell, right? Because how do you break open a cell? So if you want to break open a cell, let's say to extract DNA, what's the first uh, step that you do?
So cell wall rupture.
Yeah, how do you do the cell wall rupture? You treat it with a strong surfactant. So
NaOH.
yeah, so whatever. So there are several ways to do this. So you can do SDS treatments. You can do, essentially, one way to break a cell wall is by treating it with a strong surfactant. So if proteins are strong surfactants, if they're simply floating around, they'll basically disrupt all your cell membranes. So so proteins are not strong surfactants; they're weak surfactants. And because they're weak surfactants, what happens is, so right, they're weak surfactants, but why are they binding to material surfaces, right? So this comes from the fact that, so if protein is a weak surfactant, it will definitely have a hydrophobic region and a hydrophilic region because it is a surfactant. It doesn't matter if it's strong or weak, but since it's a surfactant, it will have a hydrophobic region and a hydrophilic region. Now, if you have a material surface, for a protein that's normally present in water, this material surface offers a large amount of hydrophobic surface. So if you look at the structure of the protein, protein is usually hydrophobic. The hydrophobic region of the protein is very well conserved at the set towards the center or core of the protein, whereas it's flanked by the hydrophilic structure, so that interactions with water can do not always disrupt the structure of the protein. But once you put a material inside, it's basically a huge surface area of hydrophobic layer where the protein does not have to interact with water. So what happens is the core gets opened up, the protein immediately goes to the biomaterial surface, the core gets opened up, and the hydrophobic structure sort of it gets absorbed and sticked onto the material surface, and basically minimizing the entropy, and that's why proteins bind to these material surfaces. Is that clear? Any questions? Okay. If not, so which of the following two statements are false about protein adsorption in biomaterials? So they're asking which of the following two statements are false. Limited adsorption sites and consequent competition means that not all proteins in the plasma phase can be represented on the surface. Driving forces for adsorption are the intrinsic surface activity and bulk phase concentration of the proteins. Once a protein gets adsorbed, it doesn't come off. Surfaces vary in selectivity of adsorption. Adsorption is highly dynamic. Proteins always lose their structure and function after adsorption. Biological activity of the adsorbed protein varies on different surfaces. What do you guys think? Which of the following two statements are false about protein adsorption in biomaterials? So you guys have covered all this Roman effect and all and protein adsorption in the lectures or not yet? Let me see if I can pull that up. Hello.
Not yet, sir.
Oh, you haven't covered them yet, is it? Okay, no problem. So we can briefly go through. Okay, so let me do this.
Still, the videos are very, very long and duration is more. We are not having such much sufficient time to finish it, sir.
Okay, okay, okay. No issues. We'll go through these concepts one by one, so it will get easier for you guys as well when you are seeing these videos. Uh,
Sir, once a protein gets absorbed, it doesn't come off. Is that a false statement?
that's true. Yeah. So it's
And
a
the
false
other
statement.
one is proteins always lose their structure and function after adsorption.
Right. Yeah. So correct. So basically, what is suggesting is so since this process of protein adsorption is a very dynamic phenomenon. What usually happens is there are two types of proteins: hard proteins and soft proteins. So soft proteins usually have low internal stability, uh, and essentially their structures are not very robust. So if you take hemoglobin, beta casein, all those proteins. Whereas hard proteins are basically proteins with high internal stability, like lysozymes, ribonucleases, so on and so forth, right? So what happens is initially when you put a biomaterial in, uh, a lot of proteins a lot of soft proteins or kinetically or sorry yeah so basically a lot of these soft proteins with very weak structural robustness, they start to come and bind to this biomaterial. But over time what happens is, so these are initially, these proteins are kinetically favored, right, because they're small in size and they're soft in their structural rigidity, so they can easily flip out and they can move faster. So all these small unstable proteins will come and bind to the biomaterial. But over time, this can be minutes, days, hours, whatever. So over time, what happens is these small kinetically favored proteins that have initially bound to this biomaterial, they get displaced over time, more and more by the thermodynamically favored proteins. So this effect is called the Roman effect, VROMANN effect. And yeah, so essentially that's why you see this. That's why this statement of once a protein gets absorbed, it doesn't come off is a false statement. And the other one, obviously, being proteins always lose their structure and function after absorption. So always is never true in biology, as they say. There is always an exception, and essentially, it really depends on the structure of the protein. If the protein is a very rigid structure, or let's say if the protein can sort of change its function or retain its function even though its structure is disrupted, then the protein would be fine even if it binds to the biomaterial. So those are the two statements that are false here. Okay. So the next question reads, consider that cells are resuspended in a rich protein solution, let's say FBS. This suspension is added on top of a biomaterial. Rank the interaction of different components, cells, water, proteins, with chronology of their interaction with the biomaterial. Okay, so essentially what they're saying is you have some FBS that contains cells. You put a biomaterial into this FBS containing cells. What comes and interacts first with the biomaterial? Is it water followed by cells followed by proteins, or water followed by protein followed by cells, and various combinations of this? What do you guys think? What is the first uh, sort of species of chemical entity that comes and interacts with this biomaterial as soon as you drop it in a protein solution containing cells? Would it be water that comes first, proteins, or cells? Or is it the case that only cells and proteins interact, or only water and cells interact?
Sir, cells.
Okay. Any other view?
So water.
Okay. Yeah, so essentially, if you're dropping something into a solution, the very first interaction is going to be with water, right? And consider this: the cells are the surface area of a cell is very large. So for it to interact with a biomaterial, it's going to take. It's not like it's going to take a very long time. The time might still be in milliseconds, but it's going to be much more longer than a flexible and free molecule such as water. Right? Water is what is H2O. It's freely moving about all over in the solution. And since it's a solution, the amount of water is also quite high compared to the number of cells or the number of proteins that are present. So, if the number of water molecules are very high, it's a very probabilistic assertion that water would come and interact with the biomaterial first. Okay, so what would be next, proteins or cells? We can follow the same logic, right? So if it's a protein rich solution, what would be more in number, the number of proteins or the number of cells? Remember, so it's like you're taking a test tube and you're putting, might not be up to scale, but you're putting a bunch of rocks, a bunch of planets, and bunch of stars. So stars are much more bigger in size. Planets are relatively smaller compared to stars. Rocks are much more smaller compared to planets, right? So what would be more? So there are a lot more rocks, fewer planets, and uh, very few stars. So if you go by that logic, if rocks are going to come and interact first because of their sheer number and their small size, they're moving about here and there. What would come next? Planets, or in this case, those would be proteins, right? Because they're much more smaller than cells. They're also more in number than cells, so they would come and interact following water. And then finally, cells, these bulky masses will start to come and interact with these biomaterials eventually after water and protein interactions have happened. Does that make sense? Any questions? Or does that make sense?
Sir, FPS means full form.
So FPS is fetal bovine serum, very protein rich.
Okay.
Yeah, it's basically serum. So serum contains a lot of proteins. Okay. Okay, so the next question reads, what are the common techniques to quantify protein adsorption on material surfaces? Two options are correct here. Is it Western blot, Northern blot, Southern blot, RT-PCR, QRT-PCR, atomic force microscopy, Eastern blotting, or surface plasmon resonance? What do you guys think? What would you use to quantify protein adsorption on material surfaces? Okay, so
So
let's,
Western blotting.
sorry?
Western blotting.
Yeah, Western blotting. That's one way to quantify proteins present. And can you guess the other one? So you can also use surface plasmon resonance. So essentially what you'll do is you take a surface, you shine a beam of light or laser on top of the surface, and you see the amount of deviation or so once the light or laser beam gets reflected, you measure the angle of reflection. So if there is a lot of adsorption, the angle of reflection would be much more higher, and if it's not, if there is not much more, if there is not much adsorption, the angle of reflection would be retained very close to the reference material that you might have, right? So for instance, you can do something like this. So you take a titanium steel rod, so you know it's going to be put in place of a bone somewhere in the leg. So you can do that. So you can take a patient, put it in his knee, or you can just suspend it in a bit of serum. So you take two titanium rods, one that is not suspended in serum, one that is suspended in serum. So you do this SPR. So one that is not suspended in the serum, that's your reference. So you will have some angle of reflection of the beam of light. But one that's suspended will show a little bit more reflection, just because there's a lot of protein that's already present coating the surface. Okay. So the next question reads, what is Roman effect? Pick one correct answer. So we've just discussed this. Is it replacement of thermodynamically favored proteins by kinetically favored proteins from a surface over time? Or is it replacement of kinetically favored proteins by thermodynamically favored proteins from a surface over time? Or is it replacement of small proteins by large proteins from surface? Or is it replacement of large proteins by small proteins from surface? Or is it replacement of soft proteins by hard proteins? What do you guys think? What is Roman effect?
Sir, if size is linked to mobility,
Correct.
do you, in that case, do you think C replacement of small proteins by large proteins is correct? Or,
Yeah, so it's partially correct.
uh,
So interestingly, so a couple of points here are partially correct. So replacement of small proteins by large proteins from a surface is true. It's partially correct, but it's also partially correct that there's replacement of soft proteins by hard proteins. So it's a
okay,
combination of the size as well as the internal stability of the structure of the protein, right? So together, the size and the stability of structure are sort of referred to as kinetically favored proteins.
okay, okay.
Yeah. And thermodynamically favored proteins are obviously ones that are much larger and much harder than the initial proteins, but essentially their adsorption is much more thermodynamically favored in the sense that the entropy is much more lower once they have adsorbed onto the surface. So, what do you guys think? Is it replacement of thermodynamically favored proteins by kinetically favored proteins, or kinetically favored proteins by thermodynamically favored proteins?
It must be kinetically.
Correct. Yeah. So initially, very initially, there's a lot of protein adsorption of kinetically favored proteins, but over time, these are replaced by the thermodynamically favored proteins. Perfect. Okay. So the next question reads: when nanoparticles are injected in vivo, the proteins form a layer on the surface of the particles. What is this layer called? Is it nucleophilic substitution of proteins? Is it nucleophilic addition of proteins? Protein corona? Electrophilic addition of proteins or electrophilic substitution of proteins?
Protein corona.
Perfect. Yeah. So it's called a protein corona. Okay. So if cells are transplanted from a human donor to a human acceptor, what kind of transplant is it? Is it allogenic, autogenic, xenogenic, antigenic?
Allogenic.
Allogenic. Yeah. So what is autogenic transplantation?
From the same from one site in the one individual to another site in the same individual.
Perfect. And what is xenogenic?
From one species to another species.
Correct. Yeah. So allogenic transplantation is where you take from a human donor and transplant it to a human acceptor. So all these liver transplantations and all those usually are allogenic. But if, for instance, you're taking a pig's heart and transplanting it to a human, then that's xenogenic. And if you're doing so if you go to clinics for this hair transplantation, so they remove parts of your hair from somewhere else in the body and transplant it on top of your forehead, right? So that's allogenic, autogenic. So allogenic is where within the same species transplantation is happening. Okay. For transplantation in humans, allografting is one of the most common approaches. What are the major drawbacks of this approach? Is it lack of donors, spread of disease, lack of oxygen in operation room? Organs can stay functional for months outside the individual. Doctors are reserved when it comes to harvesting organs, or the current technology cannot support organ replacement surgery. So allografting
Lack of
is
donors.
correct. Yeah. So lack of donors might be a problem because you're transplanting within the same species from one individual to the next. So lack of donors is a huge problem, in fact, for allografting in humans. What is the other? What could be the other major drawback?
Should it be organs cannot stay functional for months, or should it say organs can?
Yeah. So if it
Drawback should be organs cannot stay.
correct. So you're right in that organs cannot stay functional, but in this case they're
Here
saying
it says organs can stay. So that's not the
no.
that's not it.
Yeah.
A spread of disease.
Yeah, correct. So, spread of disease is another major drawback when it comes to allografting. So, spread of disease is usually very it's a major concern when it comes to any of allogenic transplantations or transfusions that might happen, right? So if you guys know the famous Bayer's case where they've essentially given HIV infected blood to people suffering with hemophilia. So that's one issue of spread of diseases. So lack of donors and spread of diseases are the major drawbacks of allografting. Okay, so the next question reads, which surface is more favorable for protein adsorption and why? Pick two correct options. Is it a hydrophilic surface because it is more charged? Is it a hydrophobic surface because it is energetically more favorable to displace water and replace with protein? Is it a smooth surface because of the available surface area? Or is it a rough surface because of the available surface area? So we've discussed this. Uh, so essentially protein adsorption happens because protein adsorption and the disruption of the protein structure happens because especially in cases where the material is hydrophobic in nature, right? So you uh, essentially the protein's hydrophobic core gets inverted out and exposed to the surface that you're injecting uh, or that you're putting in. So with a more hydrophilic surface, there is no reason for the protein to come and interact and stick to it, right? Because proteins are naturally in a hydrophilic environment inside your body, uh, which is essentially serum or whatever water-based solution that you might have in your body. So it does not make sense for proteins to come and interact and adsorb onto a hydrophilic surface. But if it's a hydrophobic surface, which is quite hard to come by for proteins, because it is energetically more favorable to displace water and replace with protein, there's a lot of adsorption that happens. So that's why it's more favorable for protein adsorption on a hydrophobic surface. What could be one other surface? Is it a smooth surface or a rough surface? So which one has more surface area available? Would a smooth surface have a more surface area available or a rough surface? So if I were to consider this a smooth surface, so let's say radius r. If I were to draw the same as a rough surface, it will be something like this. Same radius. But which one has more surface area? Message.
The rough surface will have more surface area.
Yeah, so the rough surface would have more surface area, so it will be more favorable for protein adsorption to happen on a rough surface. So if you're putting in a very rough surface, you're basically giving the body a lot of hydrophobic region with so much surface area, so a lot of protein would get absorbed. So the two correct options are hydrophobic surface because it's energetically more favorable to displace water, and because rough surface also has a large surface area. Okay. Okay, so moving on, we have a numerical here which says consider that proteins adsorb on the surface of an implant using a monolayer model. According to the Langmuir adsorption isotherm, theta is equal to k times p by 1 plus kp, where theta is the ratio of sites occupied by the molecule and total sites available for adsorption. K is equal to 2 millimolar inverse or 1 over 2 millimolar, and P is the concentration of the molecule. The cytokine is trapped inside the chamber at a concentration of 2 millimolar. Sorry, K is 2 per millimolar, and P is the concentration of molecule which they have given as 2 millimolar. And they are saying if there are total 10 to the power of 5 total binding sites, how many of them will be occupied at steady state? Assume equilibrium conditions and write the answer as a multiple of 10 power 4. I'll read this once again. So they've given this adsorption isotherm. Uh, they're saying theta will be equal to k times p by 1 plus kp. theta is basically the ratio of sites occupied by the molecule by total sites available for its option. K they've given as K is a constant, rate constant, and they've given it as 2 per millimolar. And P is the concentration of the molecule, which they've given as 2 millimolar. They're saying there are a total of 10 to the power 5 sites that can be occupied. So these are binding sites that are available for proteins to adsorb onto them. Now, basically, they're asking how many of these sites are actually occupied at steady state. Does anyone know how to solve this? Let's see. People can still see my screen, right? I'm writing.
Yes, sir.
Okay. K times P by 1 plus K times P. So this is the formula they've given us, and we know K is equal to 2 per millimolar, and P is the concentration they've given as 2 millimolar. Now what they're asking is how many sites are occupied at steady state. We also know the total available sites to be 10 to the power 5, and we also know one other crucial information, which is what the definition of theta is. So theta, they are saying it's the sites occupied by the molecule by total sites available for adsorption. So sites occupied divided by total available sites. So this is the information that we have. So fairly straightforward. So we can calculate theta from here. So theta would be K times P, which is 2 times 2 divided by 1 plus 2 times 2. So that would be what? 2 to 4 by 5. So 4 by 5. Now we also know theta is sites occupied by total available sites. So we know 4 by 5 is equal to sites occupied, which we do not know, which is what we want, by total available sites we know. They've given us 10 power 5, right? So 10 to the power 5. So all you have to do is calculate the sites occupied. So sites occupied will be 4 by 5 times 10 power 5, which is what? 4 by 5 is how much? 0.8, right? So this will be 0.8 times 10 power 5 is the total number of sites occupied. Now they're asking us to write the answer as multiple of 4. So this will become 8 into 10 power 4 sites. So these are the total number of sites that are occupied at steady state. Any questions? Does that make sense?
Yes, sir.
Yeah, so fairly straightforward question. So since they're asking you to write the answer as a multiple of 10 power 4, you will just write answer 8. So the actual answer is 8. 8 times 10 power 4, which is, since they're asking you to write it as a multiple of 4, the answer would be 8. Okay. Do you guys have any other questions? Go through the lectures. Hopefully it will be a little bit more easier for you guys now. Once you, since you've gone through the assignment questions, so make sure you pay attention to, uh, please discuss answer only, sir, one more time.
Sir, can I ask a question?
Yeah.
Well, I mean, yeah, I am a teacher myself, and
Okay.
I have over 20 years of experience, but generally, this is the first time I'm taking the NPTEL.
Mm-hmm.
The level of difficulty of the final exam,
Mm-hmm.
vis-a-vis what we have been discussing week-wise,
Mm-hmm.
in terms of assignments, the level of difficulty.
Right. So, what was the question again? So you're
The
asking.
question, I mean, the relative level of, we have been going through these assignments, and you have been discussing,
Right.
and
Right.
it's been very useful,
Hmm.
to be able to answer the questions based on the discussion.
Hmm.
Now, the final assessment in end of October,
Hmm.
for all practical, is a closed book exam.
Right.
In terms of the level of difficulty, I
Hmm.
mean, in comparison with these assignments,
Yeah.
would they be the same level of difficulty, or do you think they will be more difficult?
Right, right, right. So definitely the final exam would be much more lengthier, obviously, but also the level of difficulty will be slightly higher. I would say only 10% higher. So,
Acha.
but if you are able to sort of go through the weekly lectures and maintain an understanding, you should be able to clear it, no issues. So,
Aha. Okay. All
like,
right.
so there'll be a lot more numericals. So you might find it a little more challenging to think on the spot and answer these numericals,
Mhm.
but I would say it's not that difficult. Like if you're very comfortable with all these weekly assignments and the weekly lectures, you should be able to find the final exam quite easy.
All right, sir. All right, sir. Thank
Yeah.
you, sir. Thank you, sir.
No problem. So Vijay, I don't know which question you were referring to when you said discuss answer only, sir. Can you please tell me the question for me?
From starting, sir.
From all the questions, is it?
Yes, sir.
Okay, okay. No problem. So we'll briefly discuss. Okay. So the first question reads: why do proteins adsorb on material surfaces? They're asking us to pick one option that's correct. So the correct option is proteins are weak surfactants. So because they are weak surfactants, they have a hydrophobic core and a hydrophilic region, right? So this enables them to interact with hydrophobic materials, and that's why they get adsorbed onto material surfaces. Material surfaces by default are most probably going to be hydrophobic because unless you make them specifically hydrophilic, which you can do, but in general they would be hydrophobic. Okay, so the next question is which of the following two statements are false about protein adsorption in biomaterials? So we have several options, but it turns out the crucial concepts in protein adsorption are it's a highly dynamic system where you see this Roman effect. So Roman effect essentially is basically initially the kinetically favored proteins will come and adsorb, which are eventually displaced by the thermodynamically stable protein adsorptions. So once a protein gets adsorbed, it doesn't come off is an incorrect statement because it will come off and it will be replaced by a more thermodynamically stable protein. And proteins always lose their structure and function after adsorption is not also true because a lot of proteins can still retain their function even for that matter structure once they see this adsorption. Some of the hard proteins retain their structures as well when they get adsorbed onto these biomaterials. Okay, so the next question is consider that cells are suspended in a rich protein solution, say solution like fetal bovine serum. This suspension is added on top of a biomaterial. And basically, what they're asking us to do is rank the interaction of different components that can interact with this surface biomaterial based on the chronology of their interactions. So, which one would start interacting first with the biomaterial, followed by which is next, and ultimately, what would be the last entity to interact with the biomaterial? So, you can apply very basic logic here. So, if it's a protein solution, obviously, proteins will be high in number, but the amount of water in the solution would be, or the number of water molecules in the solution would be much more higher. And because water molecules are much more flexible in terms of their movement because of their smaller size compared to proteins, they will be the first ones to interact with the biomaterial surface, followed by proteins. which are followed ultimately by the much more bulkier cells. So water would interact first with the biomaterial surface, followed by protein interactions, followed by the cells. Okay. Following that, we discussed techniques to quantify protein adsorption on material surfaces. Two of the most commonly used techniques to quantify protein adsorption on material surfaces are one, as you might all know, is Western blotting, where you quantify proteins, and the other one is surface plasma on resonance, which, in case you haven't learned, I think in the lectures you will learn about surface plasma on resonance and briefly about how it works. So these are the two techniques that people generally use to quantify protein adsorption on material surfaces. Okay, so the next question is Roman effect. Like I just said, so Roman effect is basically replacing kinetically favored proteins eventually by thermodynamically favored proteins over a surface over time from a biomaterial surface. So that's Roman effect. And the next question reads, when nanoparticles are injected in vivo, the proteins form a layer on the surface of the particles. What is this layer called? So it's called a protein corona, in case you haven't you haven't gone through that portion of the lecture yet. But so yeah, so it's a definition. So it's called protein corona. And the next question reads, if cells are transplanted from a human donor to a human acceptor, what kind of transplant is it? Uh, yeah, so it's an allogenic transplant because it's within the same species from one individual to the next. If it's within the same species from the same individual, that will be autogenic. If it's between different species, that will be xenogenic. Okay. So the next question reads, for transplantation in humans, allografting is one of the most common approach. What are the major drawbacks of this approach? So allografting is again within the same species from one individual to another individual. So what would be the most common drawback when you're doing this from one individual to the next individual? So you would need one donor and one recipient for this to happen, right? So recipients, even though they are huge in number, donors might not be very big in number. So in human transplantation, lack of donors is always a major problem. And the other obvious drawback is spread of diseases. So if the donor has some kind of disease or some kind of, let's say, viral infection or something that has not been treated for or not been diagnosed, so if you take that organ and put it in a recipient, now you're basically giving him the infection that the donor had. So spread of disease is also a major drawback when it comes to allografting. Okay. So the next question is, which surface is more favorable for a protein adsorption and why? Is it a hydrophilic surface or a hydrophobic surface? So if you go through the protein adsorption and Roman effect and all this, you will start to realize that hydrophobic surface is what is the most important for protein adsorption to happen, because it is energetically more favorable to displace water and replace with protein. And also surface area is a very big factor when it comes to protein adsorption. If there is a large surface area, a lot of protein adsorption is going to happen, right? So they're asking which of the following options are more favorable for protein adsorption. So obviously a larger surface area is much more favorable. And now then the question is, which one would have a larger surface area? Is it a smooth surface or a rough surface? Of the same radius, a rough surface would have much more larger surface area compared to a smooth surface. So hydrophobic rough surfaces are much more favorable for protein adsorption than hydrophilic smooth surfaces. Okay, so next we've discussed this numerical, where basically uh, the question reads, consider that proteins adsorb on the surface of an implant using a monolayer model. According to Langmuir adsorption isotherm, they've given us theta is equal to k times p by 1 plus kp. Now we know theta is the ratio of sites occupied by the molecule by total sites available for adsorption. So that's theta here. And now we know K is equal to 2 per millimolar, and P is the concentration of the molecule, which is 2 millimolar. Now what they're asking is, if there are total of 10 to the power 5 binding sites, how many of them will be occupied at the steady state? So the question is fairly straightforward once you tease apart the various parameters that they've given in this paragraph. Basically, they've given you everything that you need to solve this question. So if you go through the question, we know theta is equal to k times p by 1 plus k times p. We know the value of k is 2. We know the value of p is 2. Now we can calculate theta fairly straightforwardly. So that will be 4 by 5 or 0.8. Now the question is asking us how many sites are occupied at steady state. They've given us the total number of available sites, which is 10 power 5. They've also told us theta is equal to sites occupied by total available sites. Now, essentially what they're asking us to calculate is this, sites occupied, right? So, you know this, you can calculate theta. So, theta is 4 by 5 or 0.8, and you know this to be 10 power 5. So the answer would be 0.8 times 10 power 5, and since they're asking you to report it as a multiple of 10 power 4, you the answer would be 8 into 10 power 4, or the final answer that you enter would be 8. Any questions? Is that clear, or do you guys have any questions? Vijay, do you want me to go over some other question?
No, sir.
Okay, great. Great. Then go through the lecture, guys. Hopefully, it will be more clear to you guys. Next week, we'll discuss week 6 questions, same time, same place. See you guys then. Have a great weekend. Thank you for joining. Bye.
Okay.